criteria. Just because if I have the pumps doesn't mean I just go on, that's a strict no. In India, you got to weigh so many other factors. Our cultural factors become important. The cultural factors out here are actually very important when you are practicing in the grassroots levels. And so it's a multidimensional thing, so it can't just be a simple yes or no.
So, going back to what you just mentioned, would you educate patients about these newer devices at the grassroots level, and how do you plan to do that?
Okay, educating these people at the grassroots level is not going to be so easy in terms of educating them about pumps, right? If you're thinking of educating them about...
Or stimulators.
Or stimulators for that matter. Poverty, addressing simple things like poverty becomes more important, do you really think that an uneducated, say, widow who has an osteoporotic fracture living in a village which has no road access would be interested or even vaguely bothered about talks on an implantable device? So that's why I said the cultural factors are also going to be important. Or even if you're talking about persons living in cities and slums, in slum areas. So there are so many other problems in day-to-day life which are going to be more important for people. Of course, that level of education, if a person has, and they are so-called techno-savvy, so it's fine. It all depends on the level of acceptance. So,
what about television as your media for broadcasting about these, or at least mentioning these devices? Do you think it will help?
The media would rather, broadcasting about how to, prevent preventable diseases would be more important in the initial phase rather than, broadcasting things about so-called implantable devices. People can't afford pacemakers for their own hearts. And we are talking of things which are, much more beyond that. So I do believe that in the current scenario in India, this is definitely a luxury. And if you are focusing on that 40% pain relief, I'm sure that you can achieve that in more than 95% of the patients with chronic pain without these devices.
What is your opinion, ma'am?
Yeah, I fully agree with you. I fully agree.
What about you, Dr. Tan?
In my, I'm really enlightened by the statements of my fellow panelists. In Singapore, however, the people are very techno-savvy. They are in touch with most of the most advanced medical advances, and they've got a big lobby which is anti-drug. They say I'd rather suffer with some pain than to take medicines. Many people don't even want to take paracetamol, and they may be receptive to these things. And if you tell them that there are no medical side effects, they always talk about visceral damage. My liver gets damaged, my kidneys get damaged. They are worried more about that. Maybe because of our traditional Chinese herbal background. So I'm all in favor of promoting knowledge in all these things, and I suppose it is our responsibility to make sure that they are given to the correct people.
Thank you. Any questions from the audience?
As you say, if I get free devices to implant in a rural setting like his, I would rather implant it in two kinds of patient. On a patient who cannot even afford medicine, doesn't have money to even buy medicine for taking care of pain, but really needs to work for a living and to probably earn for his family. And if the device is coming free, I'll put it in him. And second spectrum of patient, I would put it on the patient who has not responded to all modalities of treatment. So these would be the two end spectrum where I would implant a free but such an expensive device.
That was my idea behind asking this question. Yes, Dr. Believe it or not, you've been out of the country for a while. To be very candid, this will be only reserved for the higher echelons of society as a last resort, the last court of appeal. Above that, expecting things for the middle class and lower class, we just have to forget about it. And I think our colleagues from Bangladesh will also agree. As on today, it will be only reserved for the rich. Whether you believe it or not, whether you accept it or not, it's going to be that way till things improve.
Whatever they said, in addition to the poverty, there is also the nutritional factor. They may not be optimally, there may be nutritional deficiencies which may be contributing to the pain. And it is not that people cannot afford. For weddings, they will spend the same amount which is supposedly a waste, but they will not spend it. Even in urban areas, those who have money also given a choice will not spend. They spend it on a cardiac surgery, they will spend it on a knee replacement when they can get better with exercise. So it is not that money is a factor, it is 30-40% relief and with no guarantee, which is the inhibitory factor, is what I feel.
I'm Dr. Mousumi Datta. I'm doing my fellowship in pain management ESI Sialda Hospital here. So I'm quite new in this area. But before that, I have done diploma in public health, and the topic is cost effectiveness. That's why I'm there to stand and speak. When you're talking about cost effectiveness, you have to think about the cost and effectiveness and how you are going to measure effectiveness. So why are we relieving pain? We are relieving pain because we want the person a better quality of life.
Exactly.
And why a better quality of life? Because that will increase the productivity for nation, for society, for his family, his or her family. Now, when you are talking about a new medicine or new device or new measure, when you are talking about cost effectiveness, think in this way. When you are choosing a patient, I have personally I have friend who is earning 4,000 per month and a friend who is earning 4 lakhs a month. So if both are suffering from the same problem, and I'm thinking about some spinal cord stimulator, my friend who is earning 4,000 rupees, even if he is pain free, what is his productivity? Will he is going to earn, or he is going to contribute more to this nation or this society or this family? Some people are, I have worked in slums, my friend and my husband, they worked in corporate hospital, my siblings are working in UK and USA. So I have a whole spectrum of the thing, insurance and all that, and in slum area, like she said, the nutritional problem, all that. And if you give someone who really need a spinal cord stimulator in a slum area, he or she will take care of that, and they can be educated. As Dr. Dham was mentioning that it's difficult to educate, not at all. When you need a thing really, they take that very fast.
They are very receptive, is what you're trying to say. And
so
you think the media can be used to educate them?
But if you are thinking about cost effectiveness, think about their productivity, what they are doing. Someone who is not going to help in any way.
That was part of my...
Some people are in our society, their mentality is like, जब खुदा दे खाने तो क्यों जाए कमाने. So what is the
point in trying to help them?
Government to spend so much money for them, because they are not going to giving back anything to government.
We are back to the correct patient selection.
Correct patient selection,
Okay.
yes.
So did anybody? Yes,
Thank you.
ma'am, go ahead.
In this situation, where most of the people in this region are poor, and it's just my thinking, and you can take it as a question to the manufacturer of these weapons, of these instruments, that can they, if it is possible for them to reduce the price or cost of this equipment for the people of this region and the others?
I think the price is considerably less in this part of the world, and they are always working towards giving a reduced price. But I have no knowledge of how it is negotiated. As far as I heard Laura say that it would be 25% less than her competitors. Now, I think it is again going to be supply and demand, okay? So if the demand is high and you are able to convince the various powers to be, and we can, again it goes back to our morning topic, if we have enough research, enough data to say that these help more than the medication, how it improves the quality of life, how they can function better as a human being, then I think obviously the demand will go up, and obviously the cost has to come down if the demand is high. I think if we are way past our time. Yes.
Okay, just
Go ahead, Dr. Weiner.
just one practical thing I would like to say. Now, suppose she just had a argument. She put her point forward. Now, suppose we assume that there are free pumps available and pretty much programmable devices, and you actually, say you're practicing, say Madam does practice in Kolkata city proper, and she puts in a pump in a say lady who stays say 150 kilometers from Kolkata proper. She lives in a small village out there. Now, is it practical for her actually, and that lady might be staying in a village where there is no electricity, right? Now, is it going to be practical for Madam Goswami, after she has put in the pump, to actually monitor that patient, and how? So let us be very practical instead of just pushing things in.
Okay, to answer your question, I think, we all have to go back to the main drawing board. And I'm very familiar with the traveling pain physician program, which is run by Dr. Vijayanand.
Yeah.
So I think we'll have to start at the grassroots level. So I won't put in a pump in a rural area if I'm not going to be available within
Exactly.
20
Exactly.
or 30
So
minutes.
that is where the free thing, when you're talking about the free thing, even if you have it free, but still there are
You
so many
need
other
the
factors.
trained person.
Not only
You-
trained, but the follow-up thing is going to be important
You
in
need a good
programmable
backup
devices.
system. You have to have a backup system.
Yeah.
There has to be a first person, a second person, a third person, a fourth person in line
Yeah, that's
before you put any of
Yeah,
that
but in
into
India,
place.
paradoxically, where in the city of joy, you just actually have just two private outlets in this whole big city of joy, where they dispense morphine. Just two outlets, can you believe that?
Yes, I can.
So we are talking pretty basic things out here. So accessibility, affordability, all these things make a difference. So we can't even think there now in terms of even if we are having free pumps. We don't have basic things available right now. The WHO basic step ladder pattern, we are nowhere near step 3. We are at step 2.
Actually, we need to set our priorities. Whether we want to focus on few patients who might be benefiting with this and procedures, or we want to focus on majority.
Okay. Do you have any concluding remarks, Dr. Tang?
If it turns out to be that this is a paradigm shift, I see many rural areas, people with smartphones, and smartphones have become affordable because of the volume that's used.
Exactly.
I mean, it needs that kind of thing to work for stimulators, and then it might change.
I was going to allude to that. India is one of the countries where the mobile phone market is the highest, and people are very familiar with using WhatsApp and Skype and other means of video. So probably we'll have to, when we go forward with these devices, we have to factor in that. So that may be one way of keeping track of your patients.
Yeah, reminds me of the French Revolution. If you can't have bread, have cakes.
Yeah.
Sort of paradox.
You wanted
Yeah,
to
I
say
just wanted to say a couple of things. I mean, for
he's getting you another.
you've kind of delved into an extremely important public health issue, not only for India, but for worldwide. And that's a whole nother conference. I came to India not to sell stimulators, but to educate pain physicians about what's out there and where we're going. How you use it and in what indications, et cetera, is up to your experience. And I hope that we've been able to impart a little bit of knowledge to you to keep up with what's going on, at least in our development.
And I would say that, you know, the stimulator should be looked as an alternative. I get to your point where you can't go on the WHO ladder. You have all these restrictions getting opioids. So then if your patient or if your government gives you a free stimulator and there is a specific indication and the patient is a suitable candidate, then you are avoiding the cost of the medication by putting in a stimulator. There's a wonderful study from Cleveland Clinic where it shows over a period of 3 to 5 years, it is actually inexpensive to have a device like this than keep the patient on medication. Yes, ma'am. Exactly.
And now even a person from, say, a distance of 100 kilometers from Calcutta will come in to one of these corporate hospitals and get a bypass done. So maybe we can look forward to a day when a patient of chronic pain will come forward for this. So it's always
Something to
good
look
to
forward
think
to.
ahead. Think
Yeah.
ahead.
Thank you all. Any further questions, or we would like to conclude this session? Thank you all for coming in and sharing your views.